Hello and welcome to Aging Matters. This is a show that is provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet. I'm the Public Advocacy and Outreach Manager for the agency. Our show is jam-packed today, and the show will be about Medicare and you. And my special guest today is John Vogel. He is a Medicare trained specialist and shared with me earlier he is doing this for 29 probably plus years. So I thank you so much, John, for spending your time with us. I know that you have a passion with regards to this Medicare situation, changes, updates for everybody, because we all know how difficult it is to understand everything and then to be able to make some wise decisions and choices. So I thank you so much for being able to update for us, to share this information, to make it simple.
Well, I will do my best to try to make it as simple as so everybody can understand. You really do have to look at your plan and make a change. It is a real shame that the federal government doesn't do this, that you can be in it for 2 years at a time. But it's every year you really do have to look at your plan, make sure it's going to be working for you, depending upon your health, what happened during that time, that fast year that went by. Things could change, more prescriptions, less prescriptions, different doctors, all that little stuff. So it is a time, and I thank you for inviting me to be here to be able to do this. Let's get right to it.
Okay, let's start first with making sure we all understand. There is what I'll call a traditional Medicare that has Part A and B and D for prescriptions and so on, and then a Medicare Advantage. Can you just tell us the differences so we understand that before we move forward?
Yes. When you enroll into Medicare, as Ann just said, you enroll into Medicare Part A and you enroll into Medicare Part B. Those are the two things on your paper red, white, and blue card that we all get. That is the Medicare traditional original enrollment going into there. After that, you can make your selections if you want to be in Medicare Part D, which is a prescription plan. At that point in time, the offer for the other side, Medicare Advantage plans, comes into play. So you can, and the interesting thing about this, Ann, is the same people who do Medicare Part D plans also are selling Medicare Advantage plans. So the names can get very confusing and you wonder, what am I enrolling in? Most, not all, Medicare Advantage plans do have prescription coverage with it. But there's a lot of things that we want to talk about. But when you do into original Medicare and you enroll into your Part A and Part B and you select a prescription plan, at that point you need to pick a supplemental policy. Sometimes they call it a Medigap policy, but you pick a supplemental policy to make sure that whatever Medicare doesn't pay, your supplemental policy is picking up.
Will pay the gap.
You will get covered. So the basic difference is that if you're an original traditional Medicare, you actually use your Medicare card when you go to the doctor. If you are in a Medicare Advantage plan, they will supply to you your ID card, and that's the one. The difference between the two is the fact once you're into a Medicare Advantage plan, you'll get no benefits at all from your Medicare original. That's the difference.
Okay, very good. Thank you. So usually at this time of year, this is the time where people have the opportunity to make changes in their coverage. And so we thought we'd spend some time on the show today talking about changes or updates for 2024. So we kind of can start looking at that, looking at our own book that we get, the Medicare and You book, look at that, and then hopefully we can share some information today about some of the key changes or updates that you can share with us that'll be occurring in 2024 to be aware of as we're looking at maybe through this open enrollment period, if we need to consider that and look at making any kinds of updates or be prepared for those changes, whether it's an increase in something or a change or a decrease.
Yep.
So
the open enrollment period, we're already into it. It started October the 15th. You have until December the 7th to make that decision. If you wait till after December 7th, you're not going to have the ability to change your plan, and you will be stuck in what you have right now. Good or bad, you will be sitting there. But there are a lot of changes in that come along. The Medicare Part A of our coverage has a deductible, and that deductible went up. Should I say again? It went up again. So now you would spend $1,632 in your Medicare Part A deductible. Your Medicare Part B also has a deductible separate from that, and that's $240. And all of us that are in Medicare, no matter which side you're on, original or Medicare Advantage plan, we all have a monthly premium for our Medicare Part B.
Okay.
Now, right now, we're all paying $164. Come January 1st, get ready, gang, we're all going to be paying $174.70. So it went up. Now, everybody always asks me all the time, Ann, okay, so are we getting a increase in our Social Security?
Is there anything going to balance that?
How do we work this out?
Yeah.
Well, yes, we are going to get another one. It's already been approved. It's a 3.2% increase, much lower than the last 3 years. It averages out, just for everybody so you have a number, it averages out to about $59 increase in your Social Security benefits. So our Part B premium went up 10, so they somehow or another grabbed out of there $10, so we're going to be paying $174.
Okay.
If you decide during this period of time, you look at it and your plan is working perfectly, absolutely, there's no problem, and I can't tell you how many people have asked me this. Well, what do I have to do, John? Do I have to call the plan? No, if you're going to stay in the exact same plan, we call it rolls over automatically, so you don't have to do anything.
No renewing.
No renewing, nothing. If you're changing plans, that's when you need to actually get to somebody. Berks Encore has the contract for years and years and years. We called it a prize. Now we call it PA Medi. You can still call it a prize to me, I don't care. But
as long as I know it's a health insurance counseling program.
It's counseling, yeah. And you can call Berks Encore and get an appointment with one of the counselors that are doing this right now besides me. And we can guide you through and give you the best suggestions of what you should be looking at. Do I do this or do I do that? How can I make I don't want to pay. I mean, right now, just for your sake, the prescription side, Part D, has a really good program, and people are just going crazy thinking this, with a 50 cents a month premium. Yes, I really did say.
You go, is there a catch to that?
That's exactly what everybody says. The opposite end of that is the high end is $195. So when you think of the gap between prescription plans, what do I do?
Right.
50 cents or $195? That's why you need to really sit down with somebody that has some knowledge of how this works so that you can actually get into a plan that'll work for you. And we talk about this every year, the deductible. The deductible that happens in the prescription plans, sorry gang, it went up again. So it's $545 annually for your Part D plan. Now, I just explained to you, we had a Part A deductible, we had a Part B deductible. Now I'm saying we have a Part D deductible. The Part D deductible does affect people tremendously, especially if they're taking brand name drugs. For the first time they walk into a pharmacy in January or February when they're getting their refills, and they go, well, that was only $47. Why is it $500?
Yeah.
The deductible, guys, $545 is the standard deductible for 2024. Some plans have a little less, but the standard is $545. So if you're saying, hey, my plan's working perfectly, no problem with that, I'm not going to change, but you don't think about that $545, that's coming out of your pocket up front. So when you go and get that prescription, that Eliquis, that Xarelto, or some other expensive, and you look and you go, wait a minute, I don't have $500 with me. Well, I guess I have to get it. Here's my credit card. Holy mackerel.
Yeah.
Somebody should have told me that it's $545. So yes, every year that we do this, and I thank you so much for doing this, there are changes. There really are. You can't just sit there and say, my plan's working perfectly, I don't have to worry about it. It's too confusing or all this. Please call, get somebody to explain these things to you. And I know a lot of times people say, I talk really fast about this, but we only have a period of time to do this.
And John, since you mentioned about making an appointment to really discuss it, if we can take 1 minute, what should a person have or bring with them to the appointment that would help in the discussion about what they want to choose and what they want to pick?
A great question. Make sure you have your health care cards. Make sure you have your original Medicare card. Make sure if you're in supplemental, bring that along. If you are in a Part D plan, make sure you bring that along. And most important, please bring your prescription list. I know a lot of people, they'll, oh, I know my prescriptions, and I go, okay, and they get down to the third one, and they can't think of, well, I know there's one more. I know.
I take it at bedtime.
I know, yeah, I know, and it's pink or orange or blue. No, bring along your prescription list, because we're really interested in knowing the name of the prescription, the dosage of the prescription, and how often you actually take that prescription. Those are the key ingredients to have a really successful appointment, to make sure, do we need to do something, or can you stay where you really are? It does make a large difference. For a long time, you and I talked about the donut hole. Well, you know, they got rid of that name and they now call it a gap in your coverage. And it does say you either fall into this gap, the old donut hole for all of us white-haired, we remember donut hole, the gap. You fall into the gap. Well, you fall into the gap at $5,000 for 2024, $5,030, and you come out of it at $8,000. So the gap is big, and this is when you were paying a minimum money in your initial coverage, and now all of a sudden I fell into the gap. What does that mean? Well, it means that those drug prices just went up, and now you're waiting to fall into something called catastrophic coverage. There is a huge change for catastrophic, and I do have quite a few people, God forbid, knock on whatever, they do fall into catastrophic coverage. The difference is up until January 1st, 2024, you continue to pay 5% for your drugs. Starting January the 1st, 2024, they all go to zero. You pay nothing. So if you...
So you really have to be catastrophic at that point.
You really,
though, so,
you've already spent $8,000, okay? So there really is a huge difference to be able to know. But these are the things when people say to me, I'm not changing my plan or anything else, and something happens during the year and they get put onto a higher priced prescription that, well, why is this all happening to me now? These are the steps. These are the ones that you really should know. If you go into a prescription that you never took before, and you go, I don't know, I don't know what's going on with it. I thought it was going to be this and it's that. We can't anticipate exactly what drugs we're going to take.
Exactly. We know where we are in this point in time when we're looking ahead, but we don't know what might occur in 2024 that causes us to experience a change in our medical condition with a new medication or something else, and that's unpredictable. But at that point, even with that, if the new prescription comes about, is there some options for people?
Yes. One of the biggest options that we have in the state of Pennsylvania is the PACE and PACE-Net program. And I like to call myself the poster boy for PACE and PACE-Net because it is so well run. The gentleman who runs it out for the state of Pennsylvania, Tom Snedden, he is absolutely, I call him a miracle man, because there are people who fall into the category you're just talking about here. The PACE-Net side of it, there's a PACE side, which is the lower income, and the PACE-Net side is the higher income. And the PACE-Net side last year had the income raised, and if your income, combined income, is $41,500, you qualify for PACE-Net. Now, what happens? Well, I just said that Eliquis or Xarelto, which is very expensive, you will get it for $15, Ann. $15. So you can always apply. And the nice, beautiful part about it is PaceNet does not cost you anything. There's no premium with it. It goes along. It's the perfect little marriage between your prescription plan and the state of Pennsylvania PaceNet program. You use both cards. You go to the pharmacy. You show them your PaceNet card. And instead of standing there in sticker shock, you're standing here saying, oh, thank you. Thank you. That was how $15. Thank you very much. So, and they have partner plans and everything else, but you can enroll in any of them, any of the prescription plans, and have the use of the PACE and PaceNet program. So, yes, there are ways and means, and again, make an appointment, come around. We started this conversation about the difference between original Medicare and Medicare Advantage plans. And for all of you that are out there and understand, you know, we still have HMO, Health Maintenance Organizations. We still have HMO plans everywhere. The providers are out there, you can buy them. And we have PPO plans, Preferred Provider Organization. They're sold by the same companies, Capital Blue Cross, Highmark, Aetna, United.
That's why it's all so confusing.
All of these companies are out there selling them. But there is always changes to the Medicare Advantage plans. And Ann and I were talking just before we came in here, because they affect people tremendously. You know, one of the issues that people don't completely understand is the networks.
Right.
Where do I go? Where do I, can I go to my doctor, my family doctor, you know, our PCP, our primary care? Okay, he's in the network. Can I go to the surgeon? Yeah, he's in there. Can I go to the hospital? Now in Berks County, as you know, we have 2 hospitals. Okay, but what happens if they want to send you to Lancaster General or
Lehigh?
Thank you, Lehigh. You have to look in your Medicare Advantage plan and make sure that they're in network. Why is this so important? The standard out of pocket money, meaning this is what you're going to take out of your pocket. The standard out of pocket money in network is $7,500. If it's the standard out of pocket money out of network is $11,300. Now we're talking a chunk of change here, all right? So if you don't review your plan, if you don't look at your plan, if you think it's working perfectly for my Medicare Advantage plan, I don't have any problems with it, guess what? You need to know you could end up putting out in network. And I'll give you, Ann, the most perfect example.
Okay.
You go to the doctor, and the doctor says, I want you to go get a test. You go get the test. They want to go to a specialist. The specialist says you need surgery. You go into, and you know it's Tower Health or Penn State. You go to one of those 2 hospitals, and everything's fine. And the day you go to get the surgery done, who comes in but an anesthesiologist? Now, most of the time they come in all dressed, ready to go to take care of you. The problem is, we never remember to ask the anesthesiologist, do you take my plan?
Okay.
And they said, no, because we are subcontracted by the hospitals. We are not really employees, we're subcontracted. And we don't take your particular Medicare Advantage plan. Well, you get a bill, and you get a bill for $2,000 or $3,000, and you're going,
I thought it was all covered.
That's exactly the statement. I thought it was all covered. And because he's not in your network, yes, they will pay part of that bill possibly, but you are now looking at $11,300 in out-of-pocket money. And it doesn't matter who we are in Berks County, that's a lot of money.
Yes.
That's a lot of money to be able, and people call me all the time and go, John, could this possibly be real? Yes, it really is. So pay really close attention to your network, network. The other one that Ann and I were talking about that is just it's so hard to understand is on a Medicare Advantage plan, you need to understand that you have to get prior authorization for certain tests. Some of them, no big deal. Go ahead and go get that test. But there are things that in the medical field that used to be, oh, you just got admitted to the hospital. Well, now we do so much outpatient stuff. Is it going to be covered? Do I need to get prior authorization? Do I need to, and this is what that means, do I need to call my plan and say, I'm going to have test? Is it going to be covered? Because you don't want to walk into getting a test done and everybody does everything. Oh, this isn't like you didn't get the test. Everybody does everything, and then 6 weeks later you get a bill and none of it was covered because you did not get prior authorization. It is becoming a very, very important part of Medicare Advantage plans.
And you know, that's like the last thing on your mind when, if you're not feeling good, you've had a lot of whatever issues, you've gone to the doctor, they're, you know, now you're going, okay, we're starting this, you know, so they send you for the test or they send you for all those consultations. You just want that, whatever it is, to stop, to be over, to be corrected, to be fixed. And that's the kind of probably not on the top of your mind to say, wait a minute, before I can go there, let me see if that's a good site or if I have to choose a different person, specialist, to be able to do that test or that treatment.
Yeah. And the other thing with your changes in your Medicare Advantage plans is cost sharing. So we all know that there was co-pays for things. But at this point in time, a lot of things are changing in your Medicare Advantage plan that you need to call. You need to call, because every plan, that's the problem with this, Ann. It's not like every plan follows the exact same route right down through. Each of those Medicare Advantage plans, be it an HMO or a PPO, have the right by federal law to create however they want to do this. And cost sharing has changed so dramatically just in the last year, but for 2024, even bigger, that you need to understand that, okay, these costs over and above my copay is what I'm going to be responsible for. And if you don't check with your plan, and Ann just told the perfect story. If I'm sick, all I want to do is get well.
Exactly.
That's all I want to do. And in between, I do whatever the doctors, whatever.
The direction from them.
I'm just going to do what they say, and I'm going to try and be the best patient I can be, and as fast as I can get home, that's what I want to do. I'm not going to ask about all this other stuff until 6 weeks later. You're getting, bills, and you're going, why am I paying for this? I shouldn't be paying for this. This is supposed to be covered.
Nobody told me.
Nobody told me. And that's why it's really, really, really important on the Medicare Advantage side to know your networks. Where can I go? Even to go to get blood work or lab work done. Make sure you know you can go this place to go get it done. Know your networks. The only way to know them is pick up the phone and call them. Know that your out-of-pocket money has gone up, and you could very well be responsible for in-network. This is people that are actually accepting your plan for $7,500, and God forbid, and knock on the old wood again, $11,300. And then on top of that, make sure you understand there is cost sharing with these plans, and you could very well be sitting looking at, a friend of mine from Philadelphia just was talking to me, and he said he was up in the northeast section of the state of Pennsylvania, and people were saying how they were coming to him and explaining they had thousands of dollars, not hundreds of dollars, but thousands of dollars that they did not realize the cost sharing was all going to be there. So when we do these updates, and we try to do them the best we possibly can, just to make you aware that these things are alive and well.
Beware. We only have a couple more minutes, John, and I would like to just briefly, because this is such a topic that can be confusing to us all, this period of time for open enrollment, we want to just share real briefly that this is the perfect time for scams and the bad people, you know, trying to scam us out, the fraud. What can you say about that briefly?
Number one, no matter what, Medicare never, ever, ever calls you. Now, if you call Medicare and set up a time for them to call you back, that's a different scenario. But Medicare will not call you. So if you get a call from somebody that's saying, I'm from Medicare, I know it's time to update your stuff, hang up. Hang up. Don't say a word to them. Hang up. If you are a person who goes online, if you're a person who gets text, if you're well, I'm on TikTok, so I can't tell you. But if you're texting or online and you see something coming from Medicare or Social Security, there's a 99.9999 chance it's fraud.
Okay.
And during this time frame, October the 15th to December 7th, the bad guys come up out of the ground. I mean, they are just all over the place trying to set you up to get, and what they're trying to do is steal your ID. And they will be the nicest people you will ever meet. They will know you. They will.
They want to help.
They
you.
want to help. They know. They can hear your cat in the background, your dog barking. They can listen to see if you're watching Vanna. They can. They are so well trained in this that you go, you know what? That guy was really, really good. Well, what did you do? Well, I gave him my Medicare ID number. Uh-oh. Uh-oh. So yes, as sad as that is, and I hate to end this on a sad note, but it is, scams, fraud is out there all the time.
To be aware.
So for me, for wrapping this all up with us, Ann, please, whatever you do, call Berks Encore, 610-374-3195. Extension 209. You can make an appointment with one of the trained Medicare specialists who work for them. We're volunteers. We will gladly go over all this with you. It's always hard because we go a little fast because it's a short time for this show.
Yeah,
but make an appointment. It doesn't matter what your coverage is. But whatever it is, please don't just think your plan's perfect.
And I also, with the counseling, it's free of charge, and they are not selling any plans. So therefore, it's a very nice way to understand what you've got and to look at what your options are for next year to help you be able to analyze your situation and make a decision. And then either they can help you right away to make those changes, or you can go home and do it yourself. Right?
Absolutely, absolutely. Yep.
All right.
Yep. And if you're a couple, a husband and wife, it's a rare breed that they're both in the same plan because one takes no prescriptions or one prescription, and this one takes 5 prescriptions or 8 prescriptions. So not everything works for everybody in the same way. It's a matter of really knowing, okay, I have A, I have B, I have D. And
what they need.
Yeah,
and what meets their need
absolutely,
at the time.
perfectly.
Well,
okay.
that's our show for today. I appreciate you tuning in to Medicare and You. Again, John Vogel, thank you so much for your experience, your expertise, and sharing that with us. It's a complicated topic, and please know that there's some resources out there, as John mentioned, or please feel free to call the Berks County Area Agency on Aging at 610-478-6500 to refer you to this resource. Thanks for tuning in to Aging Matters.